Welcome everyone to this local Outbreak Engagement Board meeting. For the benefit of members of the public, I'm Hal Wollaston, Executive Policyholder for Public Health and Community Wellbeing, Leisure and Culture, and Chairman of this board. I'll be assisted today by James Townsend as clerk for the meeting and by Kevin Griffin, who is the Zoom host. I'll now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by a show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you will be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you, James. Do we have any apologies?
We have apologies from Councillor Martha Vickers and Andy Sharp.
Thank you. Moving on to the minutes. Does anybody have any comments about the minutes, or are you happy for me to sign them, members? Okay, do we have any declarations of interest, members? Okay. In that case, we'll move on to item 4, and can I ask Dominic Berwick to introduce our guest tonight?
Good evening, everybody. At a recent private meeting of the LOEB, we discussed the possibility of hearing from our schools to find out how they have been dealing with the pandemic, what responses they've made, and the challenges they've faced. And this evening, Dr. Charlotte Wilson, head teacher of Trinity School in Newbury, is here to tell us about her experience. Thank you. Good evening, Dr.
Good evening, everyone. Thank you for inviting me to this meeting. What I thought I'd do is just take you through, first of all, a really brief outline of the things that we've done in our schools. So in the Newbury Academy Trust, we've got Trinity School, which is secondary school, and then Furtree and Speenham Land, which are primary schools. So in our primary schools, I think much like other primaries, we've been able to bubble our classes so that their class is in that room the whole time, same children, same teaching staff. We've had staggered start and end times to the day, staggered breaks and play times and lunches, and we've been able to bubble our clubs after school as well. We've also, in all our schools, our first line of defence has been increased hand washing and hand sanitising, and we've put in rules, regulations around that and been really strict on that with children and staff. We've limited visitors to schools, and at Trinity, because we're a secondary school, our staff and students are wearing face masks for movement around the school as well. At Trinity, we've done something slightly different to our primaries. We have bubbled our year groups, which are much bigger groups, 200 plus. Slightly different for year 7 and 8. They have remained in tutor groups in one room. You will know at secondary, children move around the school. We haven't done that leading up to Christmas. They've stayed in one room with their tutor group the whole time, so we haven't set them either. And that's brought pros and cons, and I'll talk through that in a little while. For our years 9 to 13, they have moved around school. They have had designated a suite of rooms that they have been able to access. And again, at Trinity, those 3 things: hand washing, good hygiene, limited visitors, and, as I say, staff and students wearing face masks around the school. In terms of the challenges, because that's one of the things that I was asked to talk about, the challenges have been similar across 3 schools. And I think the one that hits me the most really is the challenge of keeping schools connected, the children and our staff and our communities connected, and also that sense of our culture and our ethos in our schools. Our 3 schools are very much about people and about the relationships within those schools. And so things like students being able to mix with each other across year groups, peer mentors, youth health champions, PM pals, all those student leadership roles have suffered in this current climate, because the children have not been able to mix because they've been restricted around school. The same with staff as well. Staff don't see each other as they normally would because they are restricted to areas. And so that sense of connection has been a challenge, and that hits the school's ethos and culture. So in terms of the solutions, all the way from lockdown, we've held virtual staff meetings and briefings. So my briefing at the start of the week is videoed so that all staff get to see us. Our staff meetings have gone online, so we use Teams, we use Zoom, and we've kept connected that way. During lockdown, we ran staff challenges and initiatives and family initiatives as well. We did a student video roundup and a staff roundup at the end of each week. And we've kept going with that as well because staff said it was something that they enjoyed. So we've kept going with those things. At our primary schools, we have done assemblies through Teams so that they are live, and the head is in their offices, and then that gets beamed out to all those classes. And there's been some real good interaction there. At Trinity, we videoed our assemblies so that the children, because tutor times are at the different times of the day now, we've videoed those assemblies and they get them at different times. One of the big focus pieces that we've had at Trinity is on a sense of belonging, and we've looked at this in terms of developing the resilience of children as they've returned to school. So each tutor group has had a belonging board that they update each week and have a piece of work around that to get that sense of community and that sense of shared a shared piece of work each week. So this week, for example, we're reaching out to our wider community, and our belonging work is part of that belonging to the local community. So our children have bought in items for the food bank, and they've got a year group a day. So we're reaching out to our wider community. We've moved some of our music events, our house events online. So they're on our social media platforms to keep connected. One thing that we do at Trinity is go to St Mary's Church to have our Christmas assemblies. The head students and I are videoing that this week. So although the children can't go, they can still have that experience. So we've tried to keep connected as best we can. We're going to trial just before Christmas our peer mentors, our year 10 peer mentors, sitting behind screens with a year 7. And we're just going to see how that goes, because we are in this for the whole year, aren't we, really, this new way of working. And so to not have that contact between year groups, we want to just keep promoting that and finding different ways of doing it. And the children are resilient, and they do adapt to new ways of working. So we're going to trial that. Another challenge has been the curriculum changes that we've put in place. At primary, there haven't been too many changes to the curriculum. Curriculum enrichment has fell foul to this. So music, our visitors coming in, that we've not been able to do those things, but staff have still tried to get in those wow moments. We're, for example, in one of our primary schools next week, we're taking the children to the letterbox to post their letters to Father Christmas. So just trying to find different ways around that. At Trinity, the bubbling in year 7 and 8 has meant that because they've been restricted to one room, it has meant that we've not been able to run as many practical lessons. So they haven't had practical dance, practical drama, D&T and art. That really helped with transition for our year 7s, because if you think they hadn't been at primary school in the summer term, so keeping them together in one group and in one place has really helped with that. But now they're ready to fly and experience secondary school. So Lynn mentioned at the start, when we were just waiting for the meeting, our new block has come online. So we've got a new 6 classroom block that wasn't ready for us in September. Now it is. It means we can move our year 11s into that room and free up some space around some more practical spaces for our year 7 and 8. We looked at all their books last week, and as I say, we found that they've developed the knowledge in those subjects, those practical subjects, but they really need to apply that knowledge now in terms of their skills. So we're looking to make changes to our curriculum as we go forward. We've still kept going with our booster activities after school for our older children. So we've still kept pushing them and filling those gaps. In all 3 schools, we had a really strong emphasis on assessing the children, not through tests, but just through the classroom to start with, to look where those gaps are. we're really lucky in L3 schools that our students, on the majority, really did buy into the online learning packages that we put in place in the summer term. So we kept going with that learning. We looked quickly in the autumn term where those gaps were. We've been able to fill those and meet those gaps, and we're moving through the curriculum. And for our year 11s, they've got mock exams next week. So we'll really be able to see the impact of them not doing year 10 exams, because we saw that with our year 13s. They would normally have done a year 12 mock. We saw the impact of them not having done that in the summer. They weren't quite exam ready. So we'll keep reviewing that as we go through. The third biggest challenge for us has been for a number of children being out of school for such a length of time without boundaries and order and structure that school provides, those challenging behaviours. So we've spent a lot of time working with those children and those families, getting them ready to get them back into school and getting them ready to say to the structures, how things need to be now. We work really closely with families about our expectations, about rules, about structures. We've also got a small number of schools, a small number of children in each school that are incredibly vulnerable and very nervous and anxious about coming back to school, as are their parents. So at Trinity, we've got an inclusion bubble where those children just come to one room on reduced timetables, and we're reviewing that weekly. So that's hit some of our families hard. And we're working hard with the different agencies like CAMS, like social services, to support those families. And it's about reassurance as well, reassuring them that school is safe, school is the best place for them to be. Staying at home is not the answer. In terms of learnings that from this, really, I would say touch on that last point, that communication is key, and just taking more time to talk to people about their anxieties, about their worries, staff, students and families, and that does take more time than it usually would, just giving people the time, and that's something that we've had to do more and more. You also asked me to comment on West Berkshire Council, things that the council did well to support the school and what didn't go so well. I always know that there is an ear there in Ian and his team if I need to pick up the phone, so I know that. The health and safety team and the support that they've given, particularly getting schools ready by providing risk assessments, has been invaluable. And even though as a trust we don't buy back at the moment into West Berkshire health and safety, when I have made inquiries, I did last week, they've been really helpful. Alice responds in a timely way, so that's been really good and really supportive. You asked me also what hasn't been done so well, and this is individual to Speenhamland School. We've been waiting a long time on the development of our Keyville unit, which is our 10-place resource for physically disabled pupils, and it's taken until this week to actually get a new disabled toilet finished. We've had 3 new children into foundation who, along with the COVID restrictions, that's just exacerbated that problem of not having that physical space for them. And our staff are working with the most vulnerable children in quite challenging circumstances in terms of changing and that physical care. And for us, that's just taken too long. It's moving now, but it's just meant that our staff have really had to endure some difficult conditions.
Lynn, I can see you have a question.
Well, first of all, thank you, Charlotte. That was a really useful presentation and addresses a lot of the issues that we've had raised with us. I've got a couple of questions, actually. You've obviously got both primary and secondary, and you've got class bubbles in your primary, and you've got whole year bubbles effectively in your secondary. How do you think that has worked? Because one of the things that was raised with myself when I was doing some sort of open public questions was the size of the numbers that may have to isolate. So have you had to have children going to self-isolation, and how do you think the different sizes of those bubbles impacts on that?
Yeah, we have. We were incredibly lucky as a school, and I think it was luck that we didn't have to have any children isolating until half term. And then after half term, We have had 3 cases at Trinity and 1 at one of our primaries. Because of and we work really closely with the West Berkshire team and public health and the DFE line to work out who we did need to send home. So in our primary, because it was the teacher that tested positive, the whole class had to be sent home along with the TAs that supported. So they're currently still out. So we've had a whole class bubble out there for 2 weeks. In our secondary, it has been really interesting because our first case was in year 7, where we've bubbled in a tutor group and they stay in that tutor group. We had to send 12 children home, and 7 of them were because of the proximity, they sat to the child in the class. The other number of students were because of contact outside, walking to school, things like that. The next case that we had was in year 11, who have got a little bit more movement around school, and we've set them so they move into different classes. We had to send 25 home. And then in our case last week was in year 12, we've had to send 55 home because they've got a lot more freedom of movement. We're treating them like adults, but then in the common room, they're quite close together. So you can see the effect of bubbling, and that has, because at secondary, because they can sit apart, because the teachers at the front, we didn't have to send that whole class home. Whereas at primary, they are mixing much more in and around the classroom and at playtime as well.
And with those older pupils, can you effectively do your own level of contact tracing so that they can actually tell you who they've been into contact with, because they know the people that they sort of hang out with?
Yes, yeah, that makes it much easier. We could go into the classroom and see where they'd sat, because one of the things we've asked all our staff to do is provide seating plans. So actually, we could, 2 days before you've got somebody off with symptoms, you're waiting for that test result to come through. Our attendance officer has already gathered that information from parents, who are the contacts, and we can start to look at the seating plans and go in and look at where those children were sitting. So when you get that call, they're positive, you can, I think we turned it around in 40 minutes.
Right.
But that you can see, we were talking about it as senior team, that you can see the effect of the bubbling, can't you? Although it's been restrictive and it's had impacts, as I've said, on curriculum in terms of practical activities and keeping everybody connected, it's had a real positive impact on the fact that we only had to send 12 home. And actually it was only 7 from being in that class. The other 7 were out of school contacts.
Okay, thank you. And then just the second question I had was, it's good to hear that you've done the assessment around deficit in learning, because that, I think, has been one of the sort of primary concerns of what sort of deficit in learning have you seen, and that people have been able to keep up with the online learning. And you've said the majority have been able to do that, but obviously there will be some gaps and some children that perhaps have had that deficit. I just wondered if you've got any bespoke methods or thoughts in place of how you address those gaps with those children that have potentially fallen behind.
Yeah, and I think, unfortunately, it's the children that were already behind. They've just fallen further behind. So we have, in a secondary school, we have kept those children that we found that have fallen further behind in one group. So they've had more literacy and more numeracy. We're just, the government tutoring package is just sort of really launched in earnest these last couple of weeks. So we're just looking at that as well. In our primaries, we've been using an online maths package that we're just trialing before lockdown, and we've continued with that. And at one of our primaries as well, we have put our PPA time in our primaries on Friday afternoons, so that the children have got the class teacher in front of them all week, and then we do send them home at lunchtime. But in one of our primaries, we're keeping our year 6 in school to actually do some catch up on that learning.
Thanks, Charlotte.
Councillor Masters.
Thank you. Thank you, Dr. Wilson. That was extremely informative. You spoke about supporting the families and children who are nervous about coming back. Have you, in terms of those numbers, have those numbers been significant, and how are you supporting those that are entrenched and quite resistant to actually coming back? Are you being flexible in their learning?
I think, to be fair, once we've had the conversation with those families that have said, look, I'm not sending them back, I'm really nervous. Once we've had the conversation with them and explained to them all the things that we're doing, all the things that their children can be doing, particularly at secondary, we haven't had anybody that hasn't sent them back once we've had those conversations. We have had a few families that have chosen now to electively home educate, which I see as slightly different. Because they've taken that road and they've taken that advice and they want to follow that. But like I said, working with those families and talking to them, where parents have been particularly nervous, they've been able to access our inclusion bubble at Trinity, and then children are starting to think about, actually, I feel more comfortable, I feel ready to actually start accessing my lessons again. And at secondary, it's been those conversations and support. And we've used our support staff in a lot of ways, because then the parent knows that they're always there, just at the end of a phone line. If you're feeling worried, just phone us, just call us. And then we've tended to get the children in. In terms of the attendance, if we take out those COVID absences, for children, we're just slightly lower across two of our schools. One of our schools is at about the same point as they would be at this time of the year last year. Two of our schools are slightly down by about 0.5% in terms of that attendance. So on the whole, that's been a real positive.
Thank you very much, Charlotte.
So Matt, you've got a question.
Yeah, thanks, Dr. Wilson. That's really helpful. It's just really just my thanks to you, I think, and all the teachers. Obviously, working in public health, working with my education colleagues, I know how challenging it's been for all of you over the last few months. So it's just to pass on my thanks, really, because I think you've done such a good job in terms of minimising risk and providing children with education, which is so important at this moment in time. So yeah, thank you.
Thank you.
Thanks, Matt. You just took my line.
Sorry, Howard.
Charles, just a real thanks for coming along. I'm sure you've reassured a number of parents who might be watching this, and thank you for what you and all your staff are doing, and to all other teachers and head teachers as well.
Thank you. Thanks for letting me share that tonight. Thank you.
That's a real pleasure, and thank you for joining us again.
Thank you.
I know you have to leave fairly shortly, so thank you.
I do. I've got a governor's meeting, so I'll leave. Thank you.
Okay. Bye-bye. Matt, passing over to you now.
Thank you, Chair. So I'm aware we've got quite a busy agenda, so I won't spend too long on the situation report today. Just as always with this report, it's dependent on the numbers when the report is written, so some of it might be a little bit out of date by a day or two. So in terms of, I think this is the main slide that we always cover in quite a lot of detail, which just gives you a summary of West Berkshire and our neighbouring local authorities and how we compare to the regional and national average. So to date, we've had 1,568 confirmed cases. In this table, we have the local authorities on the left-hand side. We have a column on testing, percentage of individuals testing positive weekly, cases per 100,000, and cases per 100,000 for those 60 or over, and the number of confirmed cases over the last 7 days. Just noticed Slough is highlighted yellow, so we'll just move that up slightly. In terms of West Berkshire, in terms of the individuals tested per 100,000 over the last 7 days, slightly down a bit, just under 300 per 100,000. I'll talk about the colours and what they mean in a second. In terms of the percentage of individuals testing positive, we're at 6%, and the arrow next to that just indicates that that's slightly lower or lower than the previous 7-day average. In terms of the cases per 100,000, when this table was put together, we were at 111. I've just looked at the latest data that was released about an hour ago. We're now back under 100 per 100,000, so about 99.1, which is a positive move. But bearing in mind that fluctuations do change quite quickly. And then cases per 100,000, also slightly lower than what we were 7 days ago, at 92 per 100,000. So again, that's positive. And we've had 176 cases over the last 7 days. So in terms of how we compare regionally, in terms of the southeast, we're lower. Then they have 180 cases per 100,000, and then per 100,000 of those 60 or plus 125. And just to reiterate, in terms of the 60 plus, that's obviously the age group we're most concerned about, as we know the health consequences are more severe and possibly can end up in hospital. The areas obviously across Berkshire that are in a bit of a tricky situation is Slough. They've got a particularly high instance of 350 cases per 100,000, and similarly in terms of cases per 100,000 of 60 plus is 260. But West Berkshire is faring relatively well, and I think we'll just have to wait to see what that trend looks like over the coming weeks to see if that is a bit of a sustained downward trend. But as I said, it's fluctuating quite a lot from day to day at the moment, but hopefully the national restrictions are having some impact, but it's slightly too early to say at this moment in time. These are just the data thresholds, and these just relate to the colours. Just following the announcement this afternoon from the Prime Minister, what we'll probably try to do is actually reflect what the new thresholds and alert levels will look like onto those previous figures I've just discussed, just so there's a bit of consistency. So these are just the indicators that Public Health England have previously used, which we've gone on. So just to give you a view in terms of how that sits regionally and nationally. So these are just the number of cases per week. West Berkshire is in the bottom left-hand side of this slide. The grey line representing England, the orange line representing the southeast, and the blue line representing West Berkshire. So as you can see, West Berkshire is statistically lower than the regional and national average. The same applies for Bracknell Forest and Wokingham as well, and Reading also has dipped down slightly as well. In terms of the epidemiology of the cases, so again, some of this data refers to Berkshire-wide, so it can be skewed depending on the demographic makeup of some of our neighbouring local authorities. The vast majority of testing is coming through Pillar 2, so that is the community testing such as Newbury Showground, with 10% in terms of hospital testing. A relatively even split in terms of male and female. And then in terms of ethnicity, again, this could be skewed from some of our other neighbouring authorities, where 54% were from white background, 30% from ethnically diverse group, and 16% had no ethnicity recorded. So again, we're still trying to get that ethnicity recorded in the data just to give us a bit more of an accurate reflection on that. The age ranges, as I mentioned earlier, we continue to keep an eye on this. West Berkshire is just here, just to the right-hand side. So this was the last 14 days between the 3rd and 16th of November. So 9% came from under 18, 30% were from 18 to 34, 45% were 35 to 64-year-olds, and 65 and over is around 16%. So a slight increase, but again, that's fluctuated a fair bit over the last few weeks, but we have seen a slight increase in the proportion of those 65 or more with COVID-19, but still relatively small numbers. So in terms of deaths, I think many of you be familiar with nationally, the data is generally showing that deaths aren't as high the second wave, mainly down to treatments, better treatments available, but also quite a significant number of these cases have come from the younger age groups. So we've only had, say only, obviously every death is a sad, but 139 COVID-related deaths during the pandemic, and then 0 deaths were recorded in the last week. So in terms of overall all-cause mortality rate, this is 21% higher, so about a fifth higher than what we'd normally see compared to a 5-year average. And again, in hospital activity, we are seeing a steady rise in COVID patients in hospitals. This is just really looking at number of hospital admissions across the southeast region. Unfortunately, we can't publicly disclose information on our local hospitals, but we are seeing a steady rise. But again, we're not seeing as many patients ill as what we did within the first wave. In terms of the outbreaks, these are just new outbreaks I've reported in the last 7 days, or incidents. So incidents are single cases, outbreaks are normally 2 or more. So in schools, covering early years, primary and secondary school and higher education, we've had 9, care homes we've had 2, and workplaces we've had 5. We're dealing with a significant outbreak in IKEA near Calcott, which Public Health England and ourselves are responding to. But we have seen quite a significant activity in schools over the last 2 weeks, which we're continuing to support schools along with our colleagues in Public Health England and Education and Public Protection Partnership. So I think it's just really key just to reiterate the key points. I think, you know, clearly hands, face and space is the key message we have to continue to get across to our public, particularly as we're still not in winter yet, and I think we need to recognise that. So really important that as we spend more time indoors, we have to follow the advice to control the spread of the virus. And social distancing is still one of the most effective things we can do to protect ourselves and each other. So just some key things really. I'll come on to the national restrictions in a minute, and obviously the announcement's only just been made this afternoon, but we know now that the national restrictions will end on the 2nd of December. We know that it will be based on regions. We're yet to hear what those regions will consist of, but we will find out on Thursday what that will be. And we know that local alert levels will be reviewed every 2 weeks, and the alert levels will still be based on a range of different criteria that the government will use. It'll be on the local R value, it'll be hospital admissions, demand on healthcare, and obviously in terms of case rates, both for the whole population and 60 plus. So that criteria, I understand, will get published as well. So we'll be able to keep the public fully informed in terms of where we are and how that relates to our current epidemiology. I think it's really important for the public as well, is just to remind people about getting their flu vaccinations. We know in December, vaccinations for people over the age of 50 will be eligible as well. So that's really important. There has been some stock issues, but we understand that is slowly improving over the coming weeks. Really keen to encourage that people continue to download the NHS Test and Trace app, and most importantly, if people do have symptoms, please do stay home and get a test. We understand the testing position is a lot better than what it was a couple of months ago. There's capacity there, so really important that people seek a test if they need it. So I'll just really summarise some key differences between the levels. Hopefully you can see that it's quite small. Again, we'll probably relay a lot more of this information. I know the government has now published online the detail behind each of these alert levels. So it'd be worth maybe in the future LOB to go through those alert levels. But the key messages is medium is still very much follow the rule of 6, both indoors and outdoors. Pubs and restaurants to close at 11 AM. Previously it was 10 AM, but obviously they're now giving an extra hour for people to get their last orders and to drink up. Encouraging minimising travel and work from home where possible. The new changes around spectators allowed at sports events and live performances, but again, this is very much, it'd be variable and based on limited numbers depending on what tier you're on. High is still around no households meeting indoors, but people can continue to meet outdoors as a rule of 6. And then personal care, including hairdressing, allowed in all 3 tiers. The only additional note that I noted was that parents with babies under the age of 2 can also now form support bubbles, so which is an exception to many of these restrictions. Finally, all the information which I talked through at this board can also be found at our berkshirepublichealth.co.uk website. So I strongly encourage both members of the board and the public to visit this website. We update the information daily, and then also give you where we are in terms of what restriction are you on in your local area and what that means in terms of what you can and can't do. So it's a really good source of information for people to stay up to date on. That concludes my presentation, Chair.
I've got Councillor Doherty.
Thank you, Matt, and thank you for pulling that together so quickly. I know we've had a busy afternoon with announcements and various things. I guess the question that is going to be on everybody's lips is, where do you think we will be come Thursday? I don't want to put you on the spot, but as we currently stand with our figures, would it be fair to say that if it was taken purely on West Berkshire, we would be looking at going back into the medium tier alert that we were when we went into local restrictions?
Yeah, thank you. You've put me on the spot. I think as things stand, possibly the medium tier. But as I said, I wouldn't want to be quoted on that. I think we'll have to wait to see what the thresholds are in terms of what the government comes out with and at what footprint. So I think we will just have to wait to see, because they might look at the trajectory as well in terms of, you know, where things are heading. So I think we just have to wait to see.
Okay, I thought I'd say it, Matt, because I think everybody will be thinking that and asking that question, where do you think we will be? So I thought it was worthwhile saying the question, though I completely recognise that there's a lot of detail still to come out, and obviously the criteria is going to be key, and we're going to have those conversations on Thursday. So I understand there's more calls between now and Thursday.
Yeah, I think the key thing, you know, no matter what level we go on, you know, I think still people just need to be, you know, really cautious, follow the rules, follow the guidance, you know, and that's fundamental going forward. And even if you're in a lower tier, people just have to comply as best they can, which they have been. And I think we're all very grateful that they have been doing so great over these last few months.
I can't see any other hands. And Matt, you covered incidents already within that, what you said. Thank you very much. That brings us on to CCG, and I'm trying to see Sally and I can't see her. Sally, you are there. Hey, you're muted, Sally.
Sorry. Can you hear me now?
I can hear you perfectly.
So I think Shyrose is on the call as well. So I can give you a sort of snapshot about what's going on. I'm based at the Royal Berkshire Foundation Trust as well as the CCG. But the work that we're doing around communications and engagement.
Sally, can I just interrupt a second? Because if there's a benefit of the public, they probably don't know what CCG is.
I'm sorry, it's a clinical commissioning group, Berkshire West Clinical Commissioning Group, and it covers West Berkshire, Wokingham and Reading. So the Royal Berkshire Foundation Trust looks after places like the Royal Berkshire Hospital and the West Berkshire Community Hospital, and the CCG is more sort of preoccupied with the GP surgeries, I suppose. But the work that we're doing here in the comms team is around making people aware that we're still open for business, and it is business as usual. It might be slightly different when they come to the hospital or when they try and access their GP surgery, but we're still obviously very keen that they carry on. So we've done a lot of joint work with our partners at West Berkshire Council and Health Watch and the voluntary sector. We've produced some videos featuring local GPs, putting those messages out that, you know, people need to access if they've got lumps, unexpected bleeding, weight loss. It's very important that they maintain that. And again, with the hospital, we've done videos which have been released across our patch again, saying that hospital's safe to come here. We've got very strict sort of infection control programs in place, you know, hands, face, space, and all that kind of stuff. I think the messages we are trying to put out is that, you know, people need to do as much as they can to protect themselves, and in their doing that, they're protecting the NHS, because obviously we're going into winter, we've got the pressures of winter as well as COVID. So as much as people can do to keep themselves well, so for example, flu vaccinations, we're doing another big push on flu vaccinations this week to get as many people who are eligible for the free flu jab to get them done, so that we can then start doing the 50 to 64 years group, which I think will come on stream in December. What else? We've also done a lot of work with the Berkshire Cancer Centre, again, you know, just to sort of alleviate concerns of people who aren't attending for scans or screenings or treatments even, because they're worried about coming into the hospital. So we've done a little video with a cancer patient who's had cancer for 4 years, who's been coming in twice a week for chemotherapy treatment, to reassure people. And there's actually going to be quite a lot about that on Radio Berkshire on Wednesday, looking at her story. One other thing that might be of interest to you, the neuro rehab patients, which were moved back into the Royal Berkshire Hospital after the first wave, have now been moved back to West Berkshire Community Hospital, simply because it's felt at the moment that, you know, they're very vulnerable patients, and that probably not being on an acute hospital site like the Royal Berkshire isn't the best place for them to be over winter and COVID. So we've moved them back to West Berkshire Community Hospital to continue their care there. that's about as much as we're doing here. I don't know if Sharon's has got anything to add from her side.
Yeah, thank you, Sally. Just a couple more bits, actually. So obviously, what a part of the work we're doing with the Acute Trust is around recovery and moving back to pre-COVID levels, and that work is progressing well, and they're dealing with the backlogs, and there's some specialties that are sort of recovering sort of quicker than others, depending. Again, it's all about the sort of exposure to COVID as part of the procedures that does slow activity down and sometimes decrease the capacity that teams have. So that's all being tracked and progressed. And then the other element that's just hot off the press actually is something that people will recognise in the press around long COVID. So we've had some guidance around, the actual official term is post-COVID syndrome, setting up assessment clinics for patients who are suffering from symptoms of post-COVID. And we're working with Royal Berkshire Foundation Trust as well as Berkshire Healthcare Foundation Trust around how those patients are managed, because it's not just about the lungs and respiratory, it's also around pain, fatigue, as well as looking at the psychology aspect of it. So it's much more of that multidisciplinary approach. And there'll be a sort of various aspects. There's already an online service that people can access to support with the post-COVID syndrome, but it's just joining that all up and working in a much more multidisciplinary way as well.
Thank you, Sharon. I can see I've got Councillor Masters.
Thank you, Chairman. Thank you both for an excellent overview. Sally, if I could ask, what initiatives have been taken by the CCG specifically to address those that have been disproportionately affected, such as the ethnically diverse communities?
Well, this is actually a piece of work that we are looking at. I can't think of any. I mean, we've done a lot of work around, we're aware that a lot of people not digitally access. So we've done a lot of work around producing hard copies of flyers with the messages on that we are also putting out online and our social media. And I went round to the Newbury Food Bank actually on Thursday. So they're now distributing that with their food parcels to some of the disadvantaged groups that they serve. And we've actually got a sort of higher level meeting on Wednesday to look at what more we can do. We are working very closely with our partners in the local authorities. We've produced a number of videos in different languages. So we've got Nepalese, Arabic, Portuguese, Polish, and we're hoping to extend that. So they are their key messages around, you know, the hands, face, space, and also about the flu vaccine. So we're extending that and looking at more languages that we can add to that. But, you know, I'm conscious that there is a lot more we could do, but we are working as closely as we can with our local authority partners, because I think they've got often, you know, through their licensing team and trading standards and groups that actually go out in their community and neighbourhood teams. You know, we're piggybacking onto them, work that they're doing, and sending our messages out with them.
Do you have specific outreach workers, people who are going out into those, you know, different communities?
I'm not aware of any at the CCG. Sharon's might be. I've not been there that long, so Sharon's might correct me on that. But we are working, as I say, with the local authorities, who I know do have, you know, really close links with their BAME forum groups. And those groups, we are reaching them through the local authorities and through the voluntary sector. We work very closely with them as well.
As I can see you waving anyway.
Thank you.
I'm quite conscious that I know Sally needs to go, so I can pick up some of those aspects as well around. So we've got some cancer champions that working with the community around, you know, particularly the Nepalese community, but we're expanding those to work with a broader across. So that was specific to Reading, but working across Berkshire West. And then the other element that we're just starting to look at, working from areas in London that have done this, is around long-term conditions and prioritising patients with health inequalities or social inequalities, around how they're brought in and reviewed earlier by GPs. So we're just working at some of the templates that have been shared around patients suffering with diabetes, respiratory conditions, and looking at that at a broader level with our colleagues in Oxford and Bucks, and then looking at what we can do in place, which is Berkshire West. So that is some work that we're starting to sort of see other areas doing, and think there's some benefit in doing that here as well. So I can update when we've moved that a bit further forward, Chair, if that helps.
Thank you.
That
Thanks
would
to
be
both
great.
of you.
Thank you.
I can't see any other hands up, so we'll move on to public protection update from Sean.
Thank you, Chair. Good evening. I'll start, if I may, then with the contact tracing. So I think the last time we spoke, we were at the very, very beginning of all of this. Just looking at where we got to in terms of from the period from the 5th to the 20th, actually, of November, which was the Thursday that we started through to last Friday. We actually referred 44 cases, of which we successfully managed to take contact tracing details from exactly half of that, in fact 50% of those. That's not to say that they were the only people we spoke to. We did speak to others, but some were very ill, some were in hospital, but we were successful in getting tracing information and actually source infection information from half of those. So we feel that that's a good start. That's people that the national system were unable to contact, and that we've now managed to put into the system in terms of contact tracing data. So I was going to talk a bit about compliance as well, if I may, Chair, but before I move on to compliance, are there any questions on that?
I can't see any hands, Sean.
Okay, thank you.
So sorry, I do beg your pardon, Councillor Macro. You're muted, Councillor Macro.
Sorry. I understand that our local contact tracing, it doesn't run into the evening. Although 7 days a week, it doesn't run into the evening. And I wondered why that was.
So it does run 7 days a week, and it has run 7 days a week since it started. Phase 2 was always going to be running it into the evening, and our plan basically is to introduce that in the next couple of weeks. In fact, we just wanted to basically to get all of our tracers with the opportunity to go through, get used to the systems and everything else. And our proposal is to intend to start an evening staff rota, basically to do evening tracing. But at the moment, as I say, it is operating 7 days a week.
Thank you.
Okay.
Could I just add to that? Councillor Macro, the people that the contact tracing scheme are currently contacting are people that have tested positive for COVID. So they should be at home self-isolating throughout the day. They shouldn't be anywhere other than at home. I think when we look at the tier 2 level of contact tracing, where you're trying to go out to their contacts, then the phasing might need to come in. But I think it's important to know at this time, the people that are being contacted locally are those that have tested positive with COVID.
Thank you. I hadn't appreciated we weren't doing the phase 2 yet. Thank you.
No, I mean that's an important point. I mean, the people we are contacting are people that we know have already tested positive, and I understand that basically, although evening tracing does add something, it doesn't. It isn't as effective as it's no more effective than daytime or weekend tracing, in the sense that people are either isolating or unfortunately, some cases in hospital. Chair, then just moving on to compliance, which has been a big area for us in the last one, in fact, since March. But in the last few weeks, we've operated under 2 regimes. First of all, the medium tier at the very beginning of the month, and then the national restrictions over the last couple of weeks. During that period, we've continued to carry out compliance checks, which range from, in the early days, checking that businesses that should have been closed were closed, through to full visits to premises to make sure that they are complying with the relevant guidance that's in place at any kind of given time. I mean, this is updated fairly regularly. In West Berkshire, we've done about 160 of those visits in November so far. And we've also dealt with, in addition to that, around about 100 service requests, some of which are requests for advice as the law changed, and we get this every single time the law changes. So we're gearing up to the 2nd of December and the changes once we know which tier we're in. But and some of them are referrals about businesses where people have actually got concerns, and we've gone out and followed those up, working with colleagues from Thames Valley Police and our own, obviously, environmental health, training centres and licensing staff. So, yeah, as I say, the next stage for us really is we will obviously push on with the contact tracing work. We've got a few more events coming in, basically with a view to tier 2, and we'll be working with public health colleagues on those as well. But the main thing for us now basically is to get ourselves ready and to work with businesses once we know which tier we're in, and looking towards the 2nd of December and the changes locally. Thank you.
Thanks, Sean. I can see Councillor Doherty.
Thanks, Sean. Thanks for that update. Sean, one of the questions I get asked quite often, and you've mentioned around the compliance and that you've responded to concerns. If a member of the public is concerned about compliance anywhere, what's the route into your team to enable them to highlight those concerns to you?
Certainly. I mean, they can contact us either by phone on Newbury 519930, or if they go to the Public Protection Partnership website, there is actually a COVID referral form where they can put full details on there. And same with any business as well, looking for advice. We're very, very keen to work with businesses, and that includes either giving advice on the phone or where they've asked us actually to go out and do visits ahead of opening and things like that to make sure that they're complying with the relevant guidance. One change actually I forgot to mention is that it does appear that with the change in law that's likely to come about in next week, that there will be new powers for local authorities in terms of the issue of improvement notices at premises where compliance perhaps isn't quite where it should be at the moment. Basically, it's either advice or prohibition at the moment, basically, and there isn't a lot in between. But the improvement notices would bring it into line with very similar kind of controls around health and safety.
Okay, thanks, Sean.
I can't see any other questions there, so thank you, Sean, and we'll move on to communications and Amanda.
Sure. I'll just give a quick update because I know that we're kind of getting closer to 7 already. So we're just continuing with kind of business as usual activities at the moment. So press releases, press briefings. We have our COVID newsletter that goes out weekly. The Hub Bulletin goes out fortnightly. We have the week notes that go out weekly. We've got a new business news bulletin that goes out every 2 weeks. We have our social media, we've done Facebook Lives, creating videos, obviously updating our website and working with our partners, town and parish councils and the community and voluntary organisations as well. In the sense of messaging that we've been doing recently, continuing with the flu jab and COVID messaging as well, still continuing with the rules around the national restrictions, and going forward, obviously, from the announcement today and what's going to happen later in the week, we'll be looking at our comms on how we will put that out to everybody. Local contact tracing is still being promoted, just so that people are aware of that activity. We distributed our leaflets that's going out to all households across the district, started today, so that's already gone out. The leaflet has also been translated into 4 languages, Hindi, Urdu, Polish and Portuguese. I'm doing a small print one on those as well so that I can hand them out to our partners, and the website has also been updated with the PDFs of that leaflet if anybody wants to go and have a look. We're looking at doing some kind of bigger comms and campaigns that we're just trying to finalise at the moment, and some of that will include campaigns for shopping local and staying safe in winter. Lynn did her Facebook Live last week, which was really good. So we've had like 3,000 views on that live. It's reached over 9,000 people and it's received 958 engagements. So that's really positive. We've done some more information out on the test and trace support payments. So that had a highlight last week with that, and we're going to do some more this week. information on the additional restriction grants, which is for businesses, that went out last week very quickly. Social insights campaign. So this is with Berkshire Health, Berkshire Public Health. The survey for that finished at the weekend. And according to the early statistics, we actually saw a really big increase on views to the dashboard from 403 to over 6,000 in a week. And we were also #1 for the number of responses to the survey. So that's really positive. It shows that, you know, our residents are interested and they're interacting, and that also the information that we're putting out via our channels is being picked up as well. And then coming up, we're going to be doing some work on some winter communications. And then obviously once we have some more information on mass testing and mass vaccination, then we will start some work on that as well. And that's an update on the comms so far.
I can see a question from Councillor Bridgman.
Not so much a question, Chairman, simply to add to what Mandip said. Members will be aware, but I think since this is a public meeting, it's useful to remind members of the public that we've just published some fresh guidance on care home visiting, and that's available through the website.
Councillor Doherty.
I just wanted to thank Mandip and the team. I think they're doing an absolutely fantastic job of getting the communication out. Matt, I did pass on to Mandip. I got an email from a member of the public today who'd received the leaflet from us, just saying how clear and concise the leaflet was and how the language was understandable, and it was a really positive feedback. I did share that with Mandip, but I just felt it was worthwhile sharing with the group. So thank you, Mandip and team.
Thank you.
Thank you. Well done, Mandip, and the team as well. Very good news. In terms of future agenda items, I think given the times at the moment, if anybody's got any members have got any ideas that they might want to raise in the next public meeting in 2 weeks' time, perhaps they could communicate them to James. Does anyone have any other business they want to raise?
Councillor Wollaston, I would suggest in 2 weeks' time we may want to add Christmas arrangements to the agenda. We would hopefully have some more idea around what that might look like.
Very sensible suggestion. Anybody else? In that case, I think that concludes all the business. Thank you all for attending, and particularly members of the public joining us. I wish you all a pleasant evening and close the meeting.